I'm frequently asked by patients when they should pursue IVF, who candidates are for IVF, and what is IVF. And IVF stands for in vitro fertilization. So technically, IVF, in vitro fertilization, stands for or means getting eggs and sperm together outside the body and fertilizing in our laboratory. That's in vitro fertilization, fertilization outside the body. Typically, fertilization, of course, is inside the body of eggs and sperm. We call that in vivo fertilization. So IVF is technically eggs and sperm together forming embryos in the lab. Candidates for IVF classically have included women who have had problems inside their pelvis or with their fallopian tubes. We call that pelvic or tubal factor infertility. And typically it's been a consequence of prior pelvic infections or pelvic surgeries where a lot of scar tissue develops inside. And now with all the scar tissue, it makes it very difficult when a woman releases an egg when she ovulates for the egg to find its way around all that scar tissue and be picked up and captured by the fallopian tube. And so a way to bypass those kind of problems is by stimulating a woman's ovaries and then collecting her eggs, getting eggs and sperm to fertilize together in the lab and forming embryos, and taking those embryos and putting them inside the uterus. Again, we bypass the fallopian tubes and pelvis, put the embryos directly in the uterus, and hopefully allow them to implant or attach and achieve a pregnancy. So even though IVF stands for in vitro fertilization, we consider IVF now the name of the entire process of going through ovarian stimulation, egg retrieval, embryo creation, and embryo transfer, and hopefully conception. Again, so candidates are tubal and pelvic factor. Also, some men have very, very low numbers of sperm. And if sperm numbers aren't great, but they're still reasonable, we can do a technique called intrauterine insemination. But some gentlemen, the sperm numbers are so low, they don't have enough even to do an IUI, and so they have to do IVF, because IVF allows us to take very low concentrations of sperm, put them together with eggs, and form embryos inside the laboratory. Finally, some patients who initially weren't candidates for IVF, but for maybe our more moderate aggressive technologies like ovarian stimulation to make multiple eggs, between 2 and 5 generally, and combine ovulation of several eggs with an insemination. Those kind of procedures only have a certain number of cycles statistically beyond which time they become less effective. And if someone's undergone ovarian stimulation insemination and they haven't conceived within usually 3 to 4 cycles, statistically the chances become less. And so those are patients who are candidates for IVF. But I also tell patients that ultimately candidates for IVF are people who have undergone and have been candidates for lesser aggressive treatments and they haven't been effective within a certain amount of time, then I start recommending IVF. But also patients who have undergone lesser aggressive treatments but know they could still undergo more because statistically it hasn't reached its limit, but they're getting frustrated. Those are also candidates for reasons for thinking about doing in vitro fertilization.